Next, invite Dr. Rajender Singh Chauhan to talk to us about banking, the know-how.
Right.
So the talks are scheduled for 7 minutes each. So I request the speakers to stick to the timings so that we'll have some time for the panel discussions and also take questions from the audience. Over to you, Dr. Chauhan.
Dr. Chauhan. Thank you very much, sir, and good afternoon, respected chairpersons on the dais and off the dais. And I see here all the audience are very senior faculties from all over India. And because I'm involved in banking for the last 20 years, and we are actually training faculties from all over Haryana in banking and keratoplasty. So it is just to give little idea of how bank work. If we look at it, that historical milestones, introduction, burdens, and functions of iBank, requirement of an iBank, and procedures and storage and preservation. Because any institute which wants to open an iBank should fulfill all the criteria, and then a committee need to inspect those criteria, and then they give the permission to start an iBank depending upon the HOTA. And that is why it is very, very important that anybody who wants to open an iBank should have all the little idea about it. If we look at the history, the first iBanking was started in 1937. And then in India, the first iBank in India was started in RIO Chennai. RIO Chennai, you must have seen, it is the 200-year-old RIO in India and the biggest one.
I'm a proud alumni of RIO Chennai.
That is wonderful. Recently, I visited that RIO. I went to the museum also. Yeah. So it is worth seeing place. And in 1960, first successful corneal transplantation was done by Dr. Dhanda in Indore. And then later on, in fact, like 1989, iBank Association of India was formed 1989. And after that, there is a lot of improvement in iBanking and keratoplasty. Now, the magnitude of the problems, everybody knows that corneal blindness can only be treated by corneal transplantation. There are around 2 million people, and out of total blind of India, 25% they are the corneal blind. And new patient every year they keep on adding, and we need actually 1 lakh keratoplasty per year to take care of these things. And this is what is an iBank basically. iBank is a non-profit organization which deals with the collection, storage, and distribution of the donor cornea for the purpose of corneal grafting, research and supply of eye tissue to other iBanks for ophthalmic purposes. So this consists of like any iBank. It has got some research activity, tissue harvesting, then tissue evaluation, then they mark the tissue that this is fit for keratoplasty, and then they have to keep this tissue till it is distributed, and then demand is asked and it is distributed. That is all the functions of iBank. In the structure, there has to be 2 sections. One is medical section and one is administrative section. Medical section is basically owned by the medical director, a qualified corneal surgeons, and trained technicians, because they will be looking after the harvesting, collection, and evaluation of the tissue. While the administrative section is also equally important, because they need to have eye donation counselors, training, social workers, health educators, clerical staff, because you have to present those in your different, every month the data has to be sent to the NPCB, and then it is as you know that eyes, that the corneas are neither purchased nor sold, and HOTA is there, so everything has to be in order. So we actually need a good administrative section to look after iBanking. The administrative section will will deal with the public awareness programs, liaison with the government, local volunteer, and then the fundraising, because this is the only area why the cornea is lacking, because the cornea has been taken over by the LASIK and Intex and so many other things, and the corneal transplantation and DSEX, they are going back, and that is why very less people are into iBanking keratoplasty. So fundraising is also an issue, because all these corneal opacities, ulceration, etc., they occurs in usually these patients who are socially and economically poor, from the poor section. The function of the medical section is tissue harvesting, evaluation, preservation, distribution, as I already told you. And then networking of the eye bank under the umbrella of national organizations like under Eye Bank Association of India, public education programs, institution of newer eye banking procedures, and training programs and development of the uniform medical standard. So if you look at it, this is a three-tier system. On the top of the tier, there are around 5 eye banking training centers which train the ophthalmologists in eye banking and keratoplasty. Then there are around 45 eye banks, and then the eye donation centers, because they are actually not eye donation centers; they are eye recipient centers. They need to go and inoculate the eyes, and then they send to the eye banks. And there are eye donation center, EDC, eye bank, and eye training center. So the functions of all these three are different. The eye donation center need to only collect the eyes and in the MK medium and send to the eye bank. Eye bank has to evaluate the tissue, will check the blood samples, and once it is found good for transplantation, then they will distribute. The eye bank training center is along with the eye banking system. They have to train the technicians and the ophthalmologists in eye banking and keratoplasty, because recently, by as per government requirement, minimum 3 months of training in eye banking and keratoplasty is required to start any corneal transplantation center in India. So these are the equipment. If you look at it, slit lamp, specular microscope for tissue evaluation, refrigerator, laminar flow hood, autoclaving, and retrieval instrument. The only thing is in eye bank training center, everything is required. Eye bank slit lamp may not be required. Slit lamp will be required, but eye retrieval center, slit lamp, specular microscope may not be required. But there should be trained people who can inoculate the tissue. Or then the serology lab is also required in eye bank training centers, and tissue processing lab and instrument for storage and storage medias as well. Manpower is also very, very important. What happens, sometimes we start eye bank without manpower, sufficient manpower, and then we find that it is very difficult to run the eye bank. So these, and the government is also not providing these people, thinking that it is not required. But so what happens, everywhere eye bank is started, and it is part-time job given to everybody. So this is corneal recovery of the retrieval, corneal processing, and then the distribution. That is the function of the eye bank. And eye donation steps, everybody knows that donor selection is done, tissue retrieval is done, corneal examination, tissue transportation, storage of the corneal tissue, and distribution is done. Recently, because in 2020, as per RPC guidelines, negative RT PCR was required, and hospital corneal retrieval program started. And I think that is the most important, because the tissue which is received is of short duration, so the good quality of tissues we receive, and we know the exact cause of death also. So exclusion criteria are depending upon the COVID protocols, and then preparation of the tissue, and this is the whole eyeball is inoculated, or only the in situ corneal scleral excision is done. And this is the corneal scleral tissue is retrieved, and then it is put in the MK medium. The corneal medium is better now, and this is the consent letter. And the blood has to be collected. It is very important, because if the it has to be seronegative, then only we can transplant the cornea. So this is storage medias, everybody knows, and serological testing, biomicroscopic examination is done, and gross examinations, slit lamp examinations, specular microscopy. This is very important, because for excellent tissue, more than 3,000 cells per millimeter square need to be there. They should only be transplanted. Usually what happens, less than optimal cell density tissue is transplanted, and the patient doesn't gain visions. And these are some of the cornea issues which should be taken care of while transplantation. And these are storage medias. And I think thank you so much.
Thank you very much. It was much needed, an overview on how we go about it. Thank you very much, sir. Very well covered. Thanks.